Shares of 23andme a little lower today after announcing they'll acquire telehealth company Lemonaid Health for $400 million. 23andme saying the deal will advance its vision of individualized primary care. Joining us now in a First on CNBC interview is 23andme CEO Anne Wojcicki, along with our very own Meg Terrell. Meg?
Well, Kelly, thanks so much. And thanks for being here. Really interesting deal today. Just tell us about your vision here, acquiring a telehealth company, a prescription drug delivery company, and integrating that with a genetics company.
Yeah. Since the beginning of the company, one thing we always, the vision was always to follow up on what Francis Collins had outlined back in 2001, which is that genetic information has the ability to really transform how we predict, prevent, and treat all human disease. And so fundamentally, the reason why we're offering genetics to our customers is because it really is transformational, not just on the ancestry side, but on your health side. And the number one thing I've learned over the 15 years that we have been giving genetic information to our customers is that it's challenging to pull it all the way through into clinical care. So people learn really valuable insights about their health, but the rest of the healthcare system is not necessarily trained on how to manage genetic information, and it's not geared towards prevention. And so much of what 23andme can do is by really helping you understand risks and really opening up a whole new world of personalized prevention and genetic-based primary care.
I think what a lot of people are trying to understand is just what people use telehealth for right now is often not things like prevention. It's things like your kid's got the sniffles. You need to know if they need antibiotics or what you're supposed to do. How do you envision this kind of a different approach to using telemedicine as prevention and primary care, and then being able to integrate, like, I've got a clotting risk disorder in my genes, so, stand up when you go for a long car ride. How do you envision this working?
I absolutely see that there's this opportunity. Our customers have been pretty clear with us. They want to have a service that's actually trained on genetics so that they can understand, is there potentially a different path of treatment, or are there different proactive steps they can actually take on prevention? And so the factor 5, the blood clotting, is a great example. And that's actually one of the reasons why I really love Lemonaid is the pharmacy component. So for example, some people find out that they are higher risk for a blood clot, and that might change the type of oral contraceptive that people want to take. So having a system where it's completely integrated, where you can actually say, I'm learning all this genetic information, and now I can translate that into the care and potentially a prescription, is what our customers have been asking for.
And the existing doctor force at Lemonaid, do they have knowledge of how to employ the genetics information you get with 23andme already, or does this require education from the company? I mean, this seems to be a problem with our medical system in general. Genetics really aren't well understood by a lot of doctors, and sometimes this information gets used wrong.
The thing that I love about Lemonaid, again, is the quality of the team. I can't emphasize enough. It is a phenomenal team of individuals, even how they have set up the physician leadership and thinking through the protocols. So they have a physician who's leading up those protocols, who comes from Kaiser Permanente and focus really on chronic disease management. And so it's that mindset that they have here, really, of how do you really help people manage what they have, or how do you really help people prevent what they might be able to? So you're absolutely right. Most people are not trained on genetics, but the one thing 23andme has in spades is genetics expertise. And what Lemonaid now is going to bring to us is the entire infrastructure to really deliver personalized genetics-based care.
Shepard Smith here. Thanks for watching CNBC on YouTube.